In this video, we'll address commonly asked questions and myths about sleep difficulties, as well as providing tips and resources for how to manage poor sleep. Sleep is essential to our physical and emotional well-being. It supports recovery and repair of our bodily cells and tissues, our mental health, memory, and clarity of thought. A deep sleep allows us to start each day refreshed and alert. Sleep hygiene refers to the habits, behaviour and environment that contribute to us getting a really good night's sleep. Sleep disturbance is a common problem, often worsened by cancer and its treatment. There can be many reasons sleep is changed by blood cancer and its treatment. Symptoms like nerve or bone pain, itching, sweating, hormone change and nausea can all affect sleep. Changes in our environment and routines, like hospital stays or treatment and tests, also interrupt our routine, along with some medications and feelings of distress and worry. Our need for sleep changes across our lifetime. We often need 9 to 10 hours as a teenager, but a lot less as an adult. Sleep is important to allow our body to repair itself, stimulate growth and development, boost our immune system, and give us energy. No, there are many things that can contribute to a better night's sleep, and we will discuss some of these. Sometimes naps are needed to manage other symptoms, for example, cancer-related fatigue. The trick is to set an alarm, make them short, and not too close to your regular bedtime. The effect of sleep deprivation is likened to being hungover. It affects our concentration, safety and effectiveness. Establishing and supporting a good sleep-wake routine improves our overall physical and mental well-being. The light generated by screens from TVs, phones, computers and tablets disrupt our natural bodily response to light and dark. We need darkness to sleep, and the light from screens disrupts this and adds to our overall difficulty getting to sleep.
I first started to experience sleep disturbance around halfway through my chemotherapy treatment. So it was around about the third cycle into my 6 cycles, and I would have 10 days at a time where I would have very, very little sleep during the night, and I would have to try and make up for it during the day and things like that. The biggest challenge with sleep disturbance was just the effect that it had on other side effects and my mood and my relationship. Everything stems from sleep. So when sleep is interrupted, you really feel the domino effect of the outplay of everything else that's happening. For me, I managed this one with pain medication, which was really challenging for me to take that on. And I also respected my doctors to do that. I also meditated every single day. Meditation became just a part of my daily ritual or just my daily routine. I also started to look into breath work and really focus on my breath and make sure that I was actually breathing deep breaths rather than shallow breaths. And another thing for me that was so beneficial was I started getting acupuncture, and I would get acupuncture twice a chemotherapy cycle. My biggest piece of advice would be ask for help. Know that it's so okay to ask for help. Know that it's actually a strength to ask for help rather than a weakness. And you are unable to run at full capacity like you were prior to treatment, and that's so okay. So be gentle with yourself, be kind with yourself, and reach out and ask for help. And if you don't have friends and family that are close by, reach out to communities, reach out to foundations like the Leukemia Foundation, because there's so much available to you when you have the courage to reach out and ask for it.
Exercise during the day. Maintain a good diet and drink plenty of water. Keep your bedroom for sleep, sex and intimacy only. Have a regular time that you go to bed and get up each day. Avoid all stimulants a few hours before bed, like alcohol, caffeine, nicotine, exercise and spicy foods. Create routines that tell your body it's time to get ready for sleep. So have an evening shower, a warm milk drink or read a book. Note down any worries or jobs in a notebook so your brain can switch off. Use a sleep app or a meditation or relaxation soundtrack to help you get off to sleep. And if you have trouble getting to sleep, get up after 20 minutes and do something quiet. Listen to some music, a podcast, and try again later. Make small and steady changes to improve your sleep over time, and ask your treating team to investigate and treat any reversible causes of poor sleep, like steroid use, pain, itch, hormonal change, sleep apnea, or breathlessness. Create a sleep space that promotes sleep. Use a supportive mattress and pillow, have a well-ventilated, dark and quiet room, a cool temperature and no screens. Keep a sleep diary if problems are ongoing, and remember to list anything that might be affecting your sleep, like medication, negative self-talk, a menstrual cycle, mood and alcohol intake. And seek counselling for repetitive emotional or mental health problems like excessive rumination, distress, worry, anxiety or difficulties in relationships. Access professional help for assessment and treatment if sleep difficulties persist. You may be eligible for a general practitioner management plan or a mental health treatment plan via your local doctor.